So right now, there are millions of women who are just suffering in silence from a biological change that makes, everyday life and intimacy incredibly painful.
Yeah, and it's a topic that still carries so much stigma.
Right, exactly. And the traditional fix has always been hormones, which, well, they aren't an option for everyone. But the new, highly controversial fix, it's a clinical wand that literally uses radio waves to heat your delicate human tissue to 113 degrees Fahrenheit.
Which sounds completely terrifying when you just hear the temperature out of context.
I mean, yeah. Today we are asking, is this a cosmetic miracle or is it a severe burn risk? Because if you're listening to this and thinking, there is no way I am letting someone point a radio frequency wand at my most sensitive anatomy, I honestly do not blame you.
No, you really can't blame anyone for being skeptical. It sounds incredibly counterintuitive, maybe even dangerous on the surface. But this intersection of physics and biology, it's actually where the cutting edge of regenerative medicine is focused right now.
Yeah, this idea of tricking the body into healing itself.
Exactly, using very controlled physical stress to force a biological reset.
Okay, let's lay out exactly what we're looking at today,
Yeah,
because we are focusing on genitourinary syndrome of menopause, or GSM.
right.
And specifically, we're diving into a symptom that affects a massive portion of the population, but usually goes completely unmentioned, which is vaginal dryness.
It's hugely
It
underdiscussed.
really is. So, to get to the bottom of this, we've pulled together this towering stack of sources for you. We are looking at everything from like the glossy cosmetic clinic brochures for devices, things like Thermiva, Formav, and PowerRF, all the way to these incredibly dense physiological research papers from the NIH.
A very wide spectrum of literature.
Definitely. And we've also got the clinical guardrails in front of us, too, like the UK's NICE guidelines and some official, rather severe FDA warnings.
Yeah, it's a landscape just filled with conflicting information. You have these aesthetic clinics promising a painless fountain of youth on one
Okay,
side,
got it.
right? And then regulatory bodies urging extreme caution on the other.
So for anyone trying to navigate this, it's got to be incredibly difficult to separate the actual science from the medical marketing.
Oh, absolutely.
And so that's our mission for this deep dive. We want to cut entirely through that marketing hype and the shiny brochures, and we want to unpack the exact biological mechanism at play for you.
Which is fascinating once you get into it.
Right. We're going to look at how radio frequency energy, like literally using electromagnetic waves to alter subepithelial temperature, how that actually alters the cellular structure to stimulate your natural vaginal lubrication.
But, to answer that, we really have to start by dismantling a very common misconception about how the body naturally lubricates itself in the first place.
Right, because the solution only makes sense once you know what the actual problem is.
Exactly. So before we can understand how radio frequency fixes the dryness, we need to establish the baseline biology. Because when most people hear the word lubrication, they assume it's just a localized gland doing all the work.
Yeah, like sweating, right, or producing saliva. You just assume a gland dries up and stops producing fluid.
Right. But while some moisture does come from glandular sources,
Hmm.
specifically the Bartholin's glands and Skene's glands, which, they're primarily active during arousal, that is only a fraction of the story.
Oh, really?
Yeah.
Ra-
A massive, crucial component of your body's natural moisture is not glandular at all. It is driven almost entirely by blood flow.
Okay, wait, blood flow. Because the sources did differentiate between two types of moisture. There's stimulated moisture from those glands, and then basal moisture.
Right. Basal moisture is just the everyday baseline hydration of the tissue that keeps everything comfortable.
And that comes from blood.
It does. It's maintained by a physiological process called vasocongestion. So if you look at the microscopic architecture of the vaginal wall, beneath the surface layer, which is the epithelium, you have this layer called the lamina propria.
Okay.
And this is a layer of connective tissue that is just packed with a dense, complex network of capillaries.
Capillaries being like the tiny microscopic blood vessels.
Exactly. So during arousal, or honestly just in a healthy, well-estrogenized state, blood surges into this capillary network. And this surge in local blood volume creates physical pressure within the tissue.
Like blowing up a balloon.
Sort of, yeah. And as that pressure builds up in the mucosa, it physically forces plasma, which is the liquid component of your blood, to push out of the capillaries and pass directly through the vaginal epithelial cells to the surface.
Oh, wow. So it's essentially filtering liquids straight out of the bloodstream to the surface?
Yes. The medical papers refer to this fluid as a transudate.
Transudate. Got it.
And this plasma transudate coalesces on the surface to create that vital moisture barrier.
Right.
It is literally the body watering itself from the inside out using its own blood supply.
Hey, let me try an analogy here to make this easier to visualize for you listening because it makes me think of a soaker hose in a garden. You know those black hoses with thousands of tiny
Oh,
pores?
yeah, that's a great comparison.
Right, so if you have a healthy water supply turned on, which represents our blood flow, the water pressure forces moisture out through the tiny pores of the hose, and that keeps the surrounding soil perfectly damp and healthy.
Exactly.
But if someone turns down the faucet, the pressure drops. Water stops pushing through the pores, and the surrounding soil just dries out completely, turning brittle and dusty.
That is exactly what happens. And
Ouch.
in human biology, the hand turning that faucet is estrogen.
Estrogen is the faucet.
Yes, estrogen is a potent vasodilator and vasoprotector. It maintains that healthy, vibrant capillary network. It keeps the connective tissue thick and elastic, ensuring that the whole pressure system works flawlessly.
But then menopause happens, and the systemic shock of menopause is so much more than just hot flashes, right? Estrogen levels just plummet.
They do, and when they do, the entire vascular architecture changes. The mucosal tissue literally thins out.
Wow.
And the fibroblasts, the specific cells responsible for producing collagen and elastin, they basically become dormant. They just go to sleep.
Gonna stop building the structure.
Right. And the existing collagen fibers undergo a process where they basically fuse together. They turn into this rigid, glassy state.
So the tissue's getting incredibly thin and stiff.
Crucially, those capillary networks retreat. The blood vessels diminish in both number and size. So returning to your soaker hose analogy, the faucet has been turned off.
And the local blood pressure required to force that plasma transitate through the cells, it simply isn't there anymore.
Exactly. And the result is profound dryness, which leads to irritation, burning, microscopic tearing, and painful intercourse. These are all hallmark symptoms of GSM.
Okay, so we've established that a lack of blood flow and compromised tissue thickness are the root biological causes of the dryness. The soaker hose is failing.
Yes.
And historically, I mean, the medical answer has been to just turn the faucet back on using localized hormone therapy, right? Like vaginal estrogen creams or rings.
Which is highly effective for many women. However, it's not an option for everyone.
Right. I was reading that patients with a history of estrogen receptor-positive breast cancers, they are often advised against it.
Exactly.
Yeah.
And additionally, many women find the creams messy, inconvenient, or they just simply prefer to avoid hormone treatments altogether.
Makes sense.
But for decades, those women were largely told they just had to suffer in silence or rely on temporary, messy artificial lubricants.
Which brings us to the physics of radiofrequency. Because the question is, how do we get that blood flow back? How do we rebuild that capillary network without using hormones?
Enter the energy-based devices.
Right. And the sources mention specific technologies here, like dynamic quadrupolar radiofrequency and temperature-controlled RF. And I think a lot of people picture a laser beam when they hear this.
That's a common misconception.
Yeah, but the sources are very careful to draw a distinction between lasers and radio frequency.
They operate on entirely different physical principles. So lasers, like fractional CO2 lasers, they are ablative. They create microscopic columns of thermal injury, starting right at the surface of the tissue.
So they basically burn tiny holes to force the tissue to heal?
Right. Radio frequency, on the other hand, utilizes electromagnetic waves. These are longer wavelengths that can penetrate deeper, bypassing the surface completely.
So it targets the subepithelial layers.
Exactly, that lamina propria where the blood vessels...
Okay, but when these electromagnetic waves dive into the tissue, what is actually generating the heat?
So when the waves are directed into human tissue, they encounter something called tissue impedance.
Impedance.
Basically, it's resistance. The tissue resists the flow of the electromagnetic energy. Think about it like rubbing your bare hands together. It creates friction.
Right, you get heat.
Exactly.
Right.
This electromagnetic resistance generates heat deep within the tissue.
Okay, let me push back on this a bit, because reading the clinical specs for these devices, they talk about heating these delicate subepithelial tissues to temperatures between 40 degrees and 45 degrees Celsius.
Correct.
And for you listening, 45 degrees Celsius is about 113 degrees Fahrenheit. If I put my hand in 113 degree water, I'm pulling it back in pain. So how is heating delicate, already thin menopausal tissue to that temperature not just inflicting a severe burn?
It's a really vital distinction, and it's where the precision of the physics dictates the biological outcome. Temperature is the entire ballgame here.
Okay.
If a device heats tissue to 57 or 61 degrees Celsius, you will cause collagen denaturation. You cause immediate, irreversible tissue shrinkage, blistering, and cell death.
Yikes. So that is a severe thermal burn.
It is, but the 40 to 45 degree range avoids that completely.
Because it's lower.
Right. 40 to 45 degrees Celsius is a highly specific therapeutic sweet spot. At this precise temperature window, you are well below the threshold of denaturation.
So you aren't burning the tissue.
No, you are inducing a very controlled, mild thermal stress.
Okay, so it's a Goldilocks zone. Not hot enough to destroy the cells, but hot enough to, like, annoy them into taking action.
Exactly. This specific temperature triggers the activation of what biologists call heat shock proteins.
Heat shock proteins.
Yes. These proteins act like cellular first responders. Their activation initiates a mild, highly controlled inflammatory cascade within the lamina propria.
So we've basically moved from the physics of tissue impedance into the biological healing cascade. The heat shock proteins sound the alarm.
Right. And remember those dormant fibroblasts we mentioned earlier?
The cells that went to sleep when estrogen dropped.
Exactly. The ones that cause the tissue to thin out. Well, the thermal stress and the resulting inflammatory cascade wake them up.
Oh, wow.
They transition from being dormant fibrocytes back into active, functioning fibroblasts.
They just get put back to work.
They do. And they have two primary jobs in this regenerative process. The first is called neocollagenesis.
Meaning making new collagen.
Yes. The awakened fibroblasts start pumping out brand new collagen and elastin fibers. This process actively restructures the extracellular matrix, restoring thickness, elasticity, and firmness to the vaginal wall.
So it reverses that rigid, glassy state the old collagen had fallen into? Okay, so we are rebuilding the structural integrity of the wall. But earlier, we established that the dryness was fundamentally a blood flow problem.
Right.
So thicker tissue is great, but how does that give us the moisture back?
That leads to the second and arguably most crucial job of the healing cascade, neovascularization.
Or angiogenesis.
It's also known in the literature as angiogenesis. The thermal stress signals the body that the area has undergone a minor trauma and needs repair.
Okay.
And the body's natural response to this specific level of heat is to build a fresh, dense network of capillaries right there in the lamina propria to support the healing process.
Wait, brand new blood vessels.
Brand new blood vessels.
I'm going to throw another analogy at you to summarize this because the biology here is dense. It sounds almost exactly like a controlled forest fire.
Oh, I like that.
Yeah, because forestry experts will deliberately set small, controlled fires to clear out dead, dry, fused brush on the forest floor.
Right.
And the fire is highly monitored. It doesn't burn the whole forest down, just like the 45-degree RF doesn't burn the tissue. But that sudden, intense thermal stress forces the entire ecosystem to reset.
Exactly.
The heat cracks open seeds that have been dormant in the soil for years, and suddenly you get a massive bloom of fresh, vibrant, green new growth.
That is a perfect way to look at it. The radiofrequency is the controlled burn. The fused, rigid collagen is the dead brush on the forest floor.
And the dormant fibroblasts are those seeds.
Yes, just waiting for a specific thermal trigger to sprout new tissue and build new blood vessels.
Amazing. Okay, let's connect this back to the big picture and close the biological loop here. Because we've used RF physics to trigger a healing cascade, and we've grown brand new blood vessels in the vaginal wall.
Right.
But how does that translate to fixing the dryness we started with?
We go right back to your soaker hose. Because those new capillaries have grown, the blood supply to the mucosa is robust once again.
Ah, so the pressure is back.
Exactly. The local blood volume increases, the hydraulic pressure system is restored, and during arousal, or even just at rest for basal moisture, that plasma transudate can once again be pushed through the epithelial cells to the surface.
The faucet is back on. The tissue is literally watering itself again, using its own blood plasma, just like it did before menopause.
That's it, exactly. And there is a secondary, equally vital biological benefit to this restructuring, too.
Oh, really?
Yeah, because the underlying tissue is thicker, more elastic, and flush with blood, the surface cells of the epithelium also thicken and mature.
Wait, so the surface tissue is getting thicker, which sounds great for structural support and preventing microtears. But I'm not seeing how thicker surface cells help with the actual dryness or, the chronic urinary tract infections that often accompany GSM.
It comes down to cellular shedding. Healthy, mature surface cells shed regularly, and when they shed, they release large amounts of a stored sugar called glycogen.
Glycogen. Okay.
Glycogen is the primary food source for lactobacilli, which are the healthy, protective bacteria that naturally live in the vagina.
So we are literally feeding the good bacteria.
Exactly. And as the lactobacilli feast on the glycogen, their natural byproduct is lactic acid.
Oh, and lactic acid drops the pH?
Yes. This influx of lactic acid drops the vaginal pH back down below 5, which creates an acidic, highly protective environment.
Right, and that acidity is what fends off bad bacteria, prevents yeast overgrowth, and stops those chronic UTIs that plague so many postmenopausal women.
Exactly. You aren't just moisturizing the surface, you are restoring the entire microscopic ecosystem. It's a complete structural and chemical reset.
That is wild. That is the biological promise of radiofrequency in this context. It's an incredibly elegant use of the body's own regenerative
It
capabilities.
really is.
So, if this treatment literally restores the ecosystem and feeds the good bacteria, it sounds like an absolute silver bullet. Right, because I'm looking at these cosmetic brochures from places like Age Rejuvenation or Thermifo providers, and they are promising zero downtime, a quick lunchtime procedure, and total symptom relief. But there has to be a catch.
There is always a catch.
You don't just like microwave human tissue without risks. And looking at our sources, the medical establishment is not nearly as enthusiastic as the marketing brochures.
No, they aren't. And it's vital to separate the validated biological mechanisms from the aesthetic marketing.
Right?
While the physiology we just discussed, the neocollagenesis and angiogenesis, is absolutely real and documented in histologic studies, the clinical reality is far more nuanced.
Because the risks are significant if the procedure is not performed flawlessly.
Exactly. The regulatory bodies are flashing some serious warning lights.
Yeah, I saw the UK's NICE guidelines, which, many consider the gold standard for evaluating clinical evidence objectively.
Right.
They explicitly state that long-term, high-quality evidence for these energy-based devices is still very limited.
Yes, they advise that these treatments shouldn't be routinely offered outside of clinical trials just yet because we just don't have decades of data on how this repeatedly heated tissue behaves over time.
And the FDA in the US went even further, didn't they?
They did.
They issued a rather severe safety communication warning against the use of energy-based devices for what the cosmetic industry broadly calls vaginal rejuvenation. What exactly prompted the FDA to step in so aggressively?
Well, the FDA's concern is directly tied to the physics we discussed. Remember that precise sweet spot of 40 to 45 degrees?
The controlled burn.
Right. If the device is not calibrated perfectly, or if the operator is not highly skilled and attentive, that temperature can easily slip into the danger zone above 50 degrees.
Wow, just a few degrees.
Yes. In an unregulated med spa environment, you might have an operator who lacks deep anatomical knowledge using a device that relies on manual temperature monitoring.
That sounds like a recipe for disaster.
It can be. The FDA warns of real documented cases of severe burns, permanent scarring, and chronic pain resulting from these treatments.
So the thermal control must be absolute.
It has to be. The mechanism that heals
Yeah.
is separated from the mechanism that maims by only a few degrees.
Literally a few degrees is the difference between waking up fibroblasts and permanently destroying the tissue.
Exactly.
Furthermore, I'm noticing in the fine print of these medical papers that clinics often market this as a permanent fix, like you just rewind the clock and walk away.
And biologically, a permanent fix is just not true.
Because the aging process doesn't stop.
Right. The patient's estrogen remains low. So the new collagen and the new blood vessels you create, they will eventually degrade over time without that hormonal support.
The brush is going to build up on the forest floor again.
Exactly. The sources indicate that patients typically require a series of 3 or 4 initial treatments spaced a month apart just to trigger the full healing cascade.
And after that,
After that, they require ongoing maintenance sessions every 6 to 12 months to sustain the results. It is an ongoing management strategy for a chronic condition, not a permanent one-and-done cure.
okay, let's summarize the incredible journey we've just been on today. Because we started with a simple radio wave.
We did.
That electromagnetic wave meets the natural resistance of your tissue, creating targeted subepithelial heat. And that precise 113-degree heat acts like a controlled forest fire, waking up dormant cells through heat shock proteins.
Right.
Then those cells launch a massive repair cascade, building fresh collagen, and most importantly, entirely new blood vessels. Finally, those new blood vessels restore the natural fluid pressure, allowing plasma transudate to push through and naturally lubricate the tissue.
Which in turn feeds the good bacteria and restores the whole ecosystem.
It's amazing.
It really highlights the sheer resilience of human biology. We aren't introducing a foreign chemical or a synthetic hormone. We are simply providing a highly specific physical stress that tricks the body into deploying its own innate regenerative capabilities.
And that is exactly why you should care about this level of detail. If you are sitting in a clinic and someone hands you a glossy brochure for an RF procedure, your aha moment today is knowing that temperature is the entire ballgame.
Absolutely.
Don't just ask, will this work, or how much does it cost? Ask the doctor. How do you monitor tissue impedance to ensure we stay strictly between 40 and 45 degrees Celsius?
Yes.
If they look at you blankly, or if they brush off the question, walk out. Understanding the cellular why behind the procedure empowers you to cut through the aesthetic marketing and make a truly informed decision about your own body.
Because knowledge is the single difference between being a passive consumer sold a miracle and an empowered patient managing their health.
Beautifully said. We're going to leave you with one final thought to mull over today. We've just spent this deep dive exploring how a highly controlled, localized thermal stress can trick our cells into reversing age-related vascular decline in one very specific part of the body.
Yeah.
But if we can hack the body's heat shock proteins to grow brand new blood vessels here, what are the ultimate limits of energy-based regenerative medicine?
It's a huge question.
Right. Could we eventually use similar biohacking temperatures to safely trigger angiogenesis and regenerate other failing vascular systems in the human body? If we can turn the faucet back on in the mucosa, where else might we be able to make the desert bloom again?